This figure 8 MCP blocking splint improves hand function, prevents claw deformity and contractures in patients with an intrinsic minus hand. This splint is indicated for individuals with intrinsic paralysis, as it assists in optimizing function and preventing flexion contractures of the IP joints, especially the proximal interphalangeal joints. In Hansen's disease, the ulnar nerve is most frequently affected in the upper extremity, leading to weakness and paralysis of multiple intrinsic hand muscles. This involvement commonly results in claw deformity of the ring and little fingers. Involvement of both the ulnar and median nerves cause clawing in the index, middle, ring, and little digits. Intrinsic paralysis results in hyperextension of the MCP joints and flexion of the interphalangeal joints, leaving the patient's hand in a position where they are unable to actively extend the IP joints. It is essential to avoid hyperextension of the MCP joints and prevent flexion contractures in the IP joints. The splint holds the MCP joints in approximately 45 degrees flexion, which allows the extensor digitorum to pull through the extensor hood to extend the IP joints. Measure the length and width needed for the splint. The average length is 14 inches, and the width is between 3/4 to 1 inch, depending on the length of the proximal phalanx. Preferred 3/32 of an inch thermoplastic material is used because it bonds during fabrication but can be separated, providing flexibility in splint fitting. The most effective thermoplastic materials you can use will have a minimum to moderate resistance to stretch, have moderate drape, allowing it to conform to the contours of the hand, and will be moderately rigid. These qualities ensure flexibility of the material during fabrication while forming a strong and supportive splint. The thermoplastic material is placed in the splint pan until it becomes flexible. First, lay the material along the dorsal aspect of the proximal phalanxes and begin molding it around the contours of the hand. Again, the goal is to hold the MCP joints at approximately 45 degrees flexion while allowing full extension of the IP joints. The ends of the splint are cut to allow room for removal and Velcro strapping. The palmar piece is molded into the palm, allowing full flexion of the digits. The digits also extend against the splint. This is also a great range of motion exercise to keep the joints loose and the skin supple. The patient can perform functional tasks while wearing the splint. Velcro hook is applied to the splint, and the splint is secured using Velfoam or similar soft strapping. The edges are smoothed via a heat gun or heated water to prevent pressure areas. The MCP joints are now held in approximately 45 degrees of flexion. This splint can be used for people with intrinsic muscle paralysis due to ulnar and/or median nerve involvement. It helps improve hand function and prevents the fingers from developing flexion contractures, especially at the PIP joints. If you would like more information on Hansen's disease and our program, you can visit us at www.HRSA.gov/Hansen's-disease or call our toll-free number at 1-800-642-2477. Additional instructional videos about the evaluation and treatment of Hansen's disease can be found in the National Hansen's Disease Program Provider Toolkit located on HRSATube.